entire COVID-19 process, just to talk a little bit about what's been going on in the last week since the last time we spoke. Eddie, thanks so much for joining us.
Of course.
So the state reopened partially last Friday, May 1st, on this orange or moderate phase. And since then, our case count has gone up to 5,724 total positive cases, with 61 deaths as of today. Do you feel like that increase at all is correlated to the reopening of the state, or is there something else potentially going on?
Yeah, it's certainly concerning. Keep in mind, once you get exposed and infected to this virus, the incubation period is around 5 to 7 days. So you get infected, you feel normal for 5 to 7 days, and you start having symptoms. And then usually it's a few days after that that you then seek care and say, okay, it's likely as COVID, or I'm, developing symptoms where I need to go to the emergency department. And so we really need to focus on kind of 10 to 14 days after an event to really determine if we're ever increasing cases. And so you're right. If we look back in the past 7 to 10 days, we've seen a rise in cases. It very well could be due to some of the loosening that is happening, because even before May 1st, people were talking about this. The Utah Leads 2.0 came out. There's talk about transitioning from red to orange. I think people in the community probably noticed that more and more people are out and about. And so it very well could be due to this loosening and this perception that we're safe. And I really think the next kind of 5 to 10 days is going to be pretty telling in terms of what our case counts do. When we look at our Intermountain hospitalization census, meaning how many patients in our hospitals have COVID-19, that number has actually increased. And that's a really good marker of kind of community transmission. And so now we're at one of the higher levels for hospital census for COVID-19. We've seen an uptick in our case counts. And so it is concerning. Yep.
So, I mean, I've noticed myself I drive still to the office a couple of days a week, and I've definitely noticed an increase in traffic. Over the last week, it's taken me a little bit longer. There's definitely more people out and about. And the state announced too that hanging out with people up to 20 instead of 10 now is more acceptable, but they want you to be very careful on who you're interacting with outside of your immediate household. What are some important tips and reminders that people should consider when they're starting to expand those social circles to people outside of who they live with?
Right. I would, have everybody think about, like, nothing's changed in the past 10 days. Our case counts are just as high, if not higher. And so going up to a group of 20 doesn't make a lot of sense at this point. Just because the governor came out and said this is okay does not mean that that's something that we need to be doing. And so I would first say I wouldn't be hanging out in groups of 20, period. Just because that announcement came out, that's based on the numbers, it's really not a good time to be doing that. People are thinking about, it's summer. How do we expand our social networks? How do we, live in this new normal, but still have the interactions we all desire to have? And these are things that we're thinking about and my family's thinking about, and it all has to be put in context for you and your family. So you really have to think about who are the people I'm going to hang out with, and then who are they hanging out with. So if you have a good friend, but that friend is out and about and is having a lot of interaction with people, that's not somebody I'd bring into the kind of your social circle. That'd be somebody I would probably say, you know what, you're not respecting this enough. I have a concern that you potentially could be infected or carrying the virus. I'm not going to hang out with you. So I'd say be really, really cognizant of the people you hang out and what they are doing. And then the other thing to really factor in to say is, well, what is the risk to you and your family if you get infected? So, do you live with older people? Do you have exposure to people that are at really high risk? Me, for example, I have a 6-week-old child. And so the idea of me going out, hanging out with a group of 10 people and coming back and potentially transmitting that virus to my 6-week-old, like, that's a level of risk that I just, won't take. And so we all have to kind of calculate this for ourselves and be really cognizant about it. So that's kind of the big who to hang out with. And then the question is how. And so what we've been thinking about is the rate of transmission of this virus outdoors compared to indoors is likely a lot less. And so it's a really nice time of year to be outside. And I would really focus on having those interactions outside and not in the house. There's lots of air that's, less likely to transmit the virus and less things to touch and then you to touch. And so we've been focusing on small, limited groups of people that we know meeting at, a park or somebody's backyard. We went up to the Elta parking lot the other day to meet another couple and had a barbecue. Those are things we can think about doing.
Question for you about the whole outdoor aspect too. How cautious should we be? I know I went and hung out with someone last night for the first time in months, and I didn't know what to do. I was like, do I bring my own cups with me? Do I bring my own blanket because we're outside? Like, what's the level of caution that we should be using right now, even just hanging out with one or two people?
Yeah, incredibly personal, discussion and decision, right? And also with, who are you hanging out with? And so we have a couple that we hang out with. They have been isolated and quarantined just like we have. And so we feel very comfortable with them because we know that they haven't left their house either. They do click list at Smith's just like we do, so we feel very comfortable with them because we know their situation, right? And so we have no problems sharing cups and, food and those types of things. If it's somebody you don't really know and really know their exposure risk, I would say bring your own. And so bring your own drinks, bring your own food, have separate utensils, still have that 6 foot distancing, that social distancing that we talk about, and just keep those barriers. You can still obviously socialize and engage with people at a safe distance, but bring your own drinks and food and all the kind of the accoutrements.
What about facilities like using a restroom at someone's house or even in a public place? Is that of a risk at all? Is that something to consider when you're going to someone's house about how long you should be hanging out with them or what other precautions to take?
Yeah, I can say we try to stay outdoors as much as possible. But clearly people can, use the facilities and those things. And you really need to focus on good hand hygiene. Making sure, your alcohol and hand sanitizer, just like you would if you were to go to the bathroom. And also really keep in mind, like making sure the people that are coming to your house are completely asymptomatic. And so they don't have cough, they don't have shortness of breath, they don't have any kind of signs or symptoms of COVID. And then make those interactions in and out of the house as minimal as possible. You enter a house and now you have all these things you can touch, these fomites, these, door handles, cups. And if you can just make sure you stay outside as much as possible. And then if you're really cautious, when your guests leave, I'd go and do a little Lysol, a little, kind of cleaning and bleach and do something really quick and wipe things down.
Another big thing that's coming up too is Memorial Day weekend, which is one of the biggest weekends, I think, for people to get married. And I know that there's been a lot of changes in society on weddings, but there's still people that potentially are going to have them. The state talked about weddings, funerals, churches a little bit differently than it has normal interactions. It's that up to 20, wearing a mask, social distancing. Is there anything else, if you are going to a wedding or an event like that coming up, that you should be cautious of? Because you'll get to that point of you probably don't know what everyone's doing, and you don't know the history of everyone's last 2 months, and you still really want to go to this event. It's very important to you. What are some things you could do for that?
I think a couple things. One is I'd be really cautious about going, just period. If you look at some of the recent outbreaks, look at the outbreak we had in Orem, it was a birthday party, and there's a person that was infected and transmitted the virus to multiple people at a birthday party. If you look at some of the things that have been published out of Georgia, it was a funeral and people were present at the funeral and a lot of people were infected. And so I think you really have to be careful about, attending some of these events, because if you start bringing in people from different geographic areas, all located centrally, and then you have a transmission event, all those people then go back to their communities and start spreading the virus in those communities. So large events, bringing people in from diverse geographic areas is one of the highest risk events. So whether it be a big wedding, a funeral, a concert, a sporting event, those are those high risk events that, one, you have a high risk of being exposed and infected potentially. And then from an epidemiology standpoint, it's a huge spreading event because now people are going back to their communities and spreading it in all these different communities, and you have all these hotspots to evaluate. So one is just do you really need to go to that event, for one? And then the second is, you're right, it's good hand hygiene. I'd wear a mask really to respect the people around you in case you have the virus in your nose. You don't want to be transmitting it into that area. And then other people can get infected. How bad would you feel if you realized you were the spreader at a big event? I mean, that would be devastating. So mask, really good hand hygiene. I wouldn't be shaking hands. I wouldn't be giving hugs. I wouldn't be doing kisses, those types of things. It's going to feel weird, and it is weird. But that's just our reality right now, especially with our case counts being, high and elevated. It may be a different story if we were down in this phase where we had very few cases. That's just not what we're in right now. And so it'd be making sure hand hygiene, wearing a mask, and avoiding that physical contact.
Yeah, I have a wedding coming up for Memorial Day weekend, and my significant other and I have been talking a lot about what to do because we're a little bit unsure. It's all local people, but again, you mentioned the fact of you don't want to be the person that you find out that you were or you did have COVID-19 and you did spread it around. So I think it's definitely a very personal thing, and it's up to your own discretion. We can't force you to do anything, but considering who you live with is very important and what you're doing. And also the fact that the symptoms have also changed a little bit from the very beginning, I think is something to look at too when you're starting to go out in public. We've added chills, loss of smell and sound, or smell and sound. So why do those symptoms keep evolving, and how are we learning that they're connected to the SARS-CoV-2?
Yeah, so this is just a sign of a viral infection that we're just learning about, right? So we've only really known about this virus since January, 4 months. And so we're evolving in terms of what we're learning. And so you're right, chills and shaking chills and lack of smell and diarrhea have now been found to be, pretty significant in people that are presenting with COVID-19. And it's because of the research that's behind all of this that we're starting to see some of these atypical symptoms. It's still typically fever, cough, shortness of breath. Those are the cardinal symptoms. But we've now seen people in the hospital that have had fever and diarrhea. We've seen people with an isolated, I can't smell. And so it really is, we're learning more and more about the virus as we go. We're getting more information every day from the people that we test, that test negative and test positive, and we compare those two. And we're able to test more people. Originally, we were just testing people that were coming into the hospital to be hospitalized, and they were coming in short of breath. And so that was the main symptom complex. But now that we're testing people as outpatients and people that have mild symptoms, we're learning more and more. That's why we see sore throat. That's why we see loss of smell. And so the more we test, the more we know, the more research we're obtaining. That's why things are being modified. And we're just trying to broaden that scope as much as we can to catch all the symptoms that could be COVID-19. And so we're detecting more people and can then go ahead and isolate and do contact tracings.
You talked a little bit about hotspots earlier, specifically the Utah County hotspots that have popped up over the last little bit. Why is it so important to test the population there, not just symptomatic, but we're also testing asymptomatic people at those hotspots right now, specifically 2 different zip codes? What's the importance of testing such a large population like that?
Yeah, so it's a really good public health exercise to really see how far that virus is spread in the community. And so you're right, our mobile testing bus is down there doing a number of different zip codes. Utah County really was a hotspot and continues to be so. It looks like their case counts are leveling off a bit, and they're not having this rapid rise. And so it really is going in and trying to identify people that are positive. So then you can go and identify their contacts and see who's positive there. And so it's this ringed approach to really try to wrap your hands around a hotspot in the epidemic to be able to get people to isolate. And so they're not spreading the virus anymore. And we do that by mass testing. And so we can go in, identify hotspots, find positives, do contact tracing on the new positives, and be able to really kind of wrap your hands around a hotspot like that. Meanwhile, the community really needs to be abiding by social distancing to really slow and mitigate that spread.
Someone just asked us about the fact that these symptoms are very similar to the seasonal flu. I don't know if they're wondering if you can tell the difference, but for myself interpreting this, I guess, how do you tell the difference yourself, whether you're having symptoms that are related to COVID-19 or symptoms that are related to the flu? Is there really a way to tell without getting tested?
The simple answer is no. We have an idea based on seeing a lot of these patients. Seasonal flu, usually influenza, so influenza A or B, usually hits like a ton of bricks. Like you feel great one day, the next day you feel terrible. COVID-19 has a slower kind of progression. Okay, that's a subtle point. And that's not something that people really need to worry about. The issue is you need to get tested, period. So if you think you have the flu, you need to get tested for COVID-19. We fortunately are in a position where influenza season has wrapped up. We're not seeing influenza in circulating in our communities right now. If we do, it's really sporadic. So if anybody has signs or symptoms of influenza, so fevers and chills, myalgias, chill, anything like that, that's COVID-19 until proven otherwise. And so as we enter the summer months, respiratory illnesses with fever, cough, shortness of breath, where in the winter we thought, well, that could be flu. In the summer, that's COVID, period, because we just don't see influenza. Now, as you get back into the fall and the winter, and you're starting to see influenza start to kick up, usually kind of late December into January and typical years, then it gets to be much harder again, because you have to differentiate between flu and COVID. And the important thing is, because influenza you can treat. We've got 2 different medications we can give for influenza that actually improves people's symptoms and also outcomes. And so it's going to be more challenging, as we move into the winter. A little bit of a side, but just to start planting the seed. But in the winter, it's going to be so important that everybody gets their flu shot to really decrease influenza as much as possible. So then we can really focus our efforts on COVID-19, expecting that we'll see it again in the winter.
Yeah, I think that's really good advice. September will be here before we know it, which is crazy. So I have a quick question for you about antibody testing. It's a huge topic that keeps coming up. I know that you did a press conference with another doctor earlier this week on it that we haven't posted yet, but we will, so people can watch that. But will you just give an update a little bit about how much it's available, what the process is like, and if you should even get the test or not?
Right. So yes, we have antibody testing. The difference between antibody testing and the standard testing that we do that are the nasal swabs. So we have the nasal swabs that look for actual virus in your nose versus antibody testing, which is a blood test that looks for an antibody to SARS-CoV-2, which just gives you the information that you likely were infected previously with SARS-CoV-2. That's all that tells you. The way you get tested is through your primary care doctor. This really needs to be a discussion with your primary care doc. And the reason is that if we find a positive antibody, all it tells us is that you were likely infected with SARS-CoV-2 previously. It tells us absolutely nothing right now about whether or not you have immunity to repeat infection with SARS-CoV-2 again. That science is just not there yet. And so we can't say positive antibody means you're good to go, you won't get infected. We can't say that. And so really, you have to ask yourself, what am I going to do with that information? Because if you have a positive antibody, it's not going to change our recommendation on how you interact with the community. It's not going to change our recommendation about social distancing or wearing a mask. There really is not a ton of actionable data for individual patients with an antibody. That may change in the next month to 2 as we're learning more and more about the antibody response and what it means. But as of today, right now, a positive antibody response doesn't tell us much. It doesn't give individuals a whole lot of actionable information.
Yeah, we see so many comments on all of our posts about people wanting this test. And I think it is important to note that, like you just said, it's not really an actionable test that you can do anything from. It's more for the science and data and you guys to figure out what to do next, and not really for the general public right now, which I think is important. Last question for you really quick. It just came through about someone who's tested positive and they quarantine for 14 days. They follow the guidelines recommended. Do they test again before they can say that they're clear of COVID-19, or what's the process for going out again to, if you need to, after you've been tested positive?
Right. So the CDC has just actually at the end of last week published new guidelines on when you can return to work and when you can get out and interact with the community. And those new guidelines are a little bit different than the previous ones, but not by much. What they say is that you have to have at least 10 days pass from when symptoms start, and you have at least 3 days without fever, without taking any antipyretics or Tylenol or ibuprofen. And so it's 10 days since symptoms started, and you're better without fever for the 3 days, and all of your respiratory symptoms are improving. At that point, you can go back to work. There are different now testing criteria too. So that's the symptom-based criteria. There's a testing-based criteria that would require you to have 2 negative tests before you go back to work. It really is dependent on your employer. Okay. Intermountain uses the symptom-based approach, where if you have COVID-19, you have to have 10 days of symptom plus 3 days without fever and all your symptoms improving, then you can go back to work. We don't use the testing-based approach. The CDC is a nice website that really walks you through the different options. The challenge, and I see a question that came in about this, is that there's some people that can have positive virus in their nose for weeks, and they can shed virus. All that is, you're detecting the RNA of that virus. We anticipate, and we think based on earlier studies, is that that's not live virus. That's just dead virus that's shedding. And so yes, you can still have virus in your nose and be asymptomatic or improved and not necessarily shed the virus. But it's an area of active science right now. And so people, yes, can remain positive, but most likely that's dead inactivated virus.
That's good to know. Sorry, I'm reading the last question that just came through the second. Someone said, it seems social distancing is an attempt to slow the spread of the virus, and that before this is all over, the entire population could be infected. Is this correct, or is it possible that herd immunity or a vaccine will stop the spread before everyone is impacted by COVID?
Yeah, so herd immunity, people talk about herd immunity a lot. We can't, we're not at a point where we can talk about herd immunity. Herd immunity is when you get 60 to 65% of the population that is immune to the infection. Okay, so measles, for example, you get a vaccine, you're immune to the infection. You're not going to get it. And so once you get to 60, 65%, there's not enough susceptible people to allow transmission of a virus to propagate in the community.
Okay.
We don't know what immunity looks like for SARS-CoV-2. So even if we went out and we did a seroprevalence study and found 60% were positive by antibody response, that by no means tells us we have herd immunity, because we don't know whether or not you can be reinfected again. Okay, so herd immunity is kind of something that we'll talk about in the years to come. Social distancing has a couple reasons we do it. One, if it's done well, you get 2 things that happen. One is you decrease how quickly that curve goes up. And so what that happens, and what that allows is it allows our hospitals to take care of the people that get sick, and it doesn't overwhelm the system. We're learning a lot from our caregivers that came back from New York City and some of the stories they have, where people weren't getting the care that they needed because their health systems were overrun. That's what we don't want to happen. And that's why we have to do social distancing, is to protect those healthcare, communities, that we can actually provide the care people need, and not just the COVID care. There's still people having heart attacks. There's still people having strokes. There's still people having, accidents that need ICU level care. And if we are fully overrun by COVID, we're not going to be able to care for those people. And so social distancing definitely does that. It also decreases the amount of people that are infected. And it really slows that curve. And so it'll decrease deaths and also decrease the number of infections. And ideally what will happen is that we'll see this kind of slow rise, the slow decline. We may start seeing cases again in the winter and the fall, and then hopefully we'll have a vaccine in 12 to 18 months from when this started. And so there's promising work already ongoing. And so then you can go out, you can vaccinate the entire population, and that's when you essentially get this herd immunity. And so that's really the intent of what's going on. If we just pulled everything back, we would have an overrun healthcare system that's not going to be able to care for the patients that get sick, and lots of people would die unnecessarily.
Yeah, I think that's a really great point, especially with the state opening too. We're not just letting people go forward with everything they're doing. It's a very slow approach that goes through the whole summer. And I think that's really important to note that, yeah, you can't just switch on a light and expect things to go back to normal. No. It's going to be around for a while. So, Eddie, is there anything else you want to mention for this week's update at all for what's going on in COVID land?
Yeah, I mean, I think keep a really close eye on those epi curves. Case counts are not decreasing. We should not be changing the way we think about social distancing or how we interact with the community. We're still in a period where we have an increase in case counts. And even though, our government has gone from red to orange, doesn't mean that we should be out socializing with big groups of people. And so really be cognizant of how you're interacting with the community, and, keep you and your family safe.
Well, thank you so much, Eddie. We really appreciate it. The COVID-19 hotline number that you guys can call if you have symptoms and would like to get screened or tested is 844-442-5224. It's a great phone number. We can triage care for you and get you tested if you'd like to find out about that. Again, with antibody testing, remember you have to call your primary care provider to figure out if you can actually get that test done. And remember what it means specifically to you individually. Eddie, thank you so much for joining us, and we'll see you again next week.
Sounds good.